Hey, Dr. Coleman, is there a link between anxiety and addiction?
Well, there's absolutely a link between anxiety and addiction because addiction involves people taking mood-altering drugs. So mood-altering drugs, mood meaning emotions, one of the primary emotions that we have is fear or anxiety. And so mood-altering drugs lessen anxiety, particularly alcohol. I mean, we all know, that when we have a drink, we feel a little bit less anxious. Well, I used to like drinking before going to a party so I could talk to girls and I wouldn't be so nervous and I could hang out with the friends and be more comfortable and confident. Dutch courage, we used to call it. And opioids do the same thing. So, of course, then the body gets used to that over time and it stops making its own natural anti-anxiety medicines, its molecules, its neurotransmitters, and so then you start getting anxiety when you don't have the drug, and that's what alcohol withdrawal is. It's intense anxiety. So clearly a lot of connections. A lot of people, their primary reason for drinking alcohol or using opioids is because it makes them feel better, because they feel less anxious. But I want to be clear, anxiety doesn't cause addiction. Addiction is in a different part of the brain. Addiction is more of a genetic vulnerability for a dopamine spike in the pleasure center. So while people may like the effect of the drugs decreasing their anxiety, that's not what causes addiction. We see lots of people with anxiety and depression, and they don't like drugs of addiction. They don't like alcohol or opioids. So they don't have the disease of addiction. They have anxiety. And we have a lot of people who have addiction who really aren't anxious at all. They like the effects of the drugs, but they don't have an anxiety problem. And then some people have a dual diagnosis, two diagnoses at the same time. They have addiction and anxiety. They need to treat both. The good news is that getting off drugs of addiction gives you an access to support groups, 12-step groups, therapy that actually are incredibly good for helping anxiety as well. So yes, there's a lot of connections.